Good day. It's certainly a pleasure to be back with you on the Healthbeat Show. I'm Dr. Jeffrey Watson, and welcome to the Healthbeat Show.
You don't have to take my word, but I heard if you have your health, you have everything. Take my word, but I heard about the Healthbeat you're gonna be. I just wanna be. Show me.
Welcome to the Healthbeat Show. I'm Dr. Jeffrey Watson, and today we have one of the most interesting shows that I think you're going to see in a long time. We're joined here by none other than Mr. Jeff Jones. He is the Executive Director of the Patient ID Center, one of the groundbreaking centers that really has dealt with medical marijuana. I would say that he's an expert on this area and has really been involved in the whole legislative aspects of it, the legal aspects of it, and the science of it. Welcome to the Healthbeat Show, Mr. Jones.
Thanks for having me on.
Thank you so much. You know, I took a class a week ago at the Oaksterdam University because I wanted to really try to find out what the whole legal aspect of medical marijuana, a little bit about the history, what are the rules and regulations for a doctor who might give a recommendation and so on. Now, take us back to your beginnings with medical marijuana. How did you get involved with this?
Well, I think like most folks that are involved in this industry from the early days, some have a personal story that got them into this. And the personal story that led me down this path was my dad passed away from cancer through a hospice program in my home. And it changed me. It made me think that the government wasn't giving out complete story about what was happening. The same year that he passed away in 1988, the DEA administrative law judge, Francis Young, came down with a ruling that said it was arbitrary and capricious that the DEA or the federal government would stand in the way of patients that have HIV, cancer, from getting this medicine, getting this plant that could help them feel a little better. When I heard that on CNN, I think I was so irritated that I didn't know what to do, and it took me a few years to respond. It made me think that I wanted to change my life from being a South Dakota native, and I dropped out of college and moved out to California and met Brownie Mary and the others that were involved in this industry. Dennis Perrone had started the San Francisco Cannabis Buyers Cooperative before the passage of Prop 215, and it was in the news, and it drew me to this area in '94. And
what is Proposition 215?
Proposition 215 was a state ballot measure that was put on the ballot in 1996 after two failed legislative attempts to change the law here in California with measures that passed through the legislature but didn't get signed because Governor Wilson wasn't all right with saying that this was an okay alternative to not having it as a relief. And the first two legislative measures were very watered down, did not give the right of a patient to grow in their home, gave them a defense if they used it and was caught after being recommended by a doctor. So what we put on the ballot with Proposition 215 in 1996 was more forward-thinking, was more empowering to a physician. Once you recommend this therapy, much like massage therapy to a patient, they're deemed legal to possess it, to grow a small garden for their own consumption, and to not otherwise put others at risk. So they're not all right to use it publicly or get behind the wheel, but they are all right to treat their condition, and that you're covered by federal law to be able to recommend and have a First Amendment privilege to discuss that as a medicine.
Okay, so 215 then actually allowed medical marijuana to be utilized by a patient, and the patient would not be arrested for possessing a certain amount of it?
Let's say that Prop 215 was a starting point, that it allowed you to have a defense in court if caught under recommended treatment from a physician. SB 420 came along in 2003 and was signed into law by Governor Davis that gave you an immunity if you chose to get your recommendation from your doctor and then go to a state card program that's run by the Department of Health. Each county is independently operating these centers. We used to to be the independent contractor that worked with the Department of Health here in Alameda County, but have since allowed the county to take the card program back over.
So 420 gave immunity
It gave immunity to patients that went through the process of getting a state identification card similar to like a DMV license or ID card. Our card program in nature gives them the right to be identified by law enforcement and have a defense, and in some cities that's enough not to get arrested, that's enough not to have your medicine taken.
So now the state card is dispensed by the Department of Public Health, is that correct? And a patient would then be on a computer-based system that the Highway Patrol or the police could go on there and see that they were
That's one of the biggest myths about the state card program. Because of me being actually a person that ran it and implemented it here in the county, I can tell you that there is no list that the county gives to the state. There is no name transfer. There is no information that a deputy, the sheriff, or highway patrol can pull up behind your car, run your plates, and then find out you have a marijuana card. The only way for them to know is for you to show it to them. Because it is a unique identifier.
So they can't go online and pull you up based on that?
They can, but it has to be a typed in number from your card. There's no name on your card, and there's only the ability to identify you to the state card program with a unique number. So it is
So
safe
the card, does the card have your picture? The state
card
card
has
your
picture, the information from where the county that admitted it and sent it out is, contact information for that office, and then a registry number that you check online or through the office. There isn't really a verified name on it outside of an issue date. There is very little information.
What about you were talking about immunity from the law? What if you had a card and you worked for a company and the company did a urine drug screen and it was positive and you said, well look, my doctor gave me this?
That is one of the most difficult parts of Prop 215 and what was left out of SB 420 is there's no protections for employment from private government or from government work when it comes to the positive screening of this because of the ability to still enforce the zero tolerance drug-free workplace, and for you as a private employer to say, I have a work relationship, this is the contract in an at-will environment that you're going to adhere to, and you have the right to screen people out because of your public safety job. And so it's not as if they're protected. There is a Senate bill that's being moved forward by Senator Leno out of San Francisco that wants to protect patients that choose to use off work time, but in our state law there is no protections. There was actually a state Supreme Court case, Ross versus Raging Wire, that said you don't get protections. If you're privately employed, you've done nothing wrong, you've actually excelled in your job and just got promoted, as this gentleman did, and then test positive because of work screening, they can fire you if they feel that that is part of their job contract.
Okay, we are right here with Mr. Jeff Jones. He is the Executive Director of the Patient ID program right here in Oakland. He is a leading expert on medical marijuana, on the legislative aspects of it. We're going to talk some about the science of it and the legal aspects of it. I'm Dr. Jeffrey Watson. Stay tuned. We got a good one for you. I'm Dr. Jeffrey Watson. We're right back here on the Healthbeat Show, and I'm joined by the Executive Director of the Patient ID Center, Mr. Jeff Jones. We're talking about medical marijuana. Now, the science behind medical marijuana. We know that it seems to help people with glaucoma. It seems to help people rest. It seems to help with pain. There are other medical disorders that I'm told that it helps with. What is the whole science behind it as far as you know?
Well, I think that it's one of the more researched plants on the planet, but it's still not completely known as to why cannabis has such a wide benefit to patients that have different conditions. I treat it more like a remedy, an herbal remedy relief, where the time that you're using it, you get the relief that it's going to provide you, and if you abstain from use and stop using it, it goes away. So it's much more akin to a St. John's wort or a ginseng, where it's an herbal remedy that's been used for thousands of years, and those things give you a benefit. Cannabis has a much more potent value to it, and the science of it helping patients when other conventional medications haven't worked is probably the reason why it's discussed today and why it caught into a vote in 1996 because of the HIV community's uprising.
It's not been passed by the Food and Drug Administration as a medication. I understand it's a Schedule 1 medication,
correct,
which says that it supposedly has no medicinal value.
And if you looked at who put that Schedule 1 status on it, which my attorneys in my federal litigated civil case did, which was Richard Nixon, and he placed a Schedule 1 status on it temporarily in a legislative committee finding until his Blue Ribbon Commission came back in 1972, known as the Schaefer Commission. And when the Schaefer Commission came back to Congress and gave their report, they said arbitrarily, it's wrong to criminalize a plant, that the worst thing about it in society for using it is that you go to jail for using it, and that to criminalize that is wrong. And they actually coined the phrase in that report of decriminalizing for the first time in a government report based on something that was done. Of course, Nixon threw that away, called it junk science, and we've stuck with the law since then.
Now, some have said, when I was younger, my mom said that stuff leads to stronger drugs. It leads to heroin, cocaine, all these other types of things. Is it considered an addictive drug that leads to stronger narcotic use?
Well, that's a great question. I think the simple answer to that is if you believe that anything that you're going to use that changes your mind or your mood would lead to a stronger drug, coffee, chocolate, anything that you might have used when you were first a kid is going to give you that mood imbalance that lets you on to something else. So if you believe that, sure. But no government report has shown a causational link between cannabis and harder drugs. The Institute of Medicine report said that it's inconclusive. Many other reports look at it a little differently. I kind of liken it to the nightlight out on your porch. When you turn it on, you see all sorts of insects and things that you've never seen out in the wild. And that cannabis is that nightlight that brings things out to find it. And that some people that use it are using it on a remedy basis and self-medicating, and they didn't even know.
Now, interestingly enough, when I went to the Amsterdam University, where I understand that you also are a professor, they indicated that doctors do not actually write a prescription, but it's a recommendation.
And that's what Prop 215 did to protect you, the physician, from getting in trouble from writing a prescription, which is still federally illegal because of its Schedule 1 narcotic status under the FDA and the DEA's ruling. It protects you by you recommending this as a therapy. You don't violate any federal law, you're within the state law, and your patient is then covered and exempted from the statutes that make it illegal for him to possess, use, and grow a small amount in his home.
By Proposition 215 and the SB 420, what is a patient allowed if the doctor recommends it? How much medical marijuana are they allowed to possess?
It's variable in some different cities to counties as to what they're allowed to possess. SB 420 tried to set up a possession limit of 6 flowering plants, 12 non-flowering plants, and up to 8 ounces in their possession. But a court ruled that it was unconstitutional because nothing in the precursor law that was passed by the voters set up a limit. So it's up to your personal need. I always say the rule of thumb to patients that sit in my grow class to learn how to grow small amounts is the less that you grow, the more apt the police are going to leave it with you if they come and find it for other reasons. And you're not trying to make a big farm out of it, but trying to show them that you're going to produce what you use. And that's really
so if a patient has a recommendation from a doctor, they're at minimum they can possess 8 ounces, they can grow 6 flowering plants or 12 non-flowering plants, and have that in their possession.
Unless you live in cities like the city of Oakland, which is more forward-thinking and is more supportive of patients meeting their own needs, and they allow you to possess and grow a lot more than that in your home. And that's just up to the local jurisdictions. And I think what it's always safe to do is less is better in this case.
And you know, as I sat in the class, I'm listening to you now, and they were actually talking about teaching people how to grow marijuana, and I said, oh my God, this is illegal. Is that illegal to teach that, learn that, do that?
Sure, you might think that it's aiding and abetting a commission of a felony, only federally, because under the state law, the patients that I see at my office and help through Amsterdam University and hands-on training are all covered to be able to grow and possess it under the state law, so they're legal. And you could say that there might be some quasi-link to that, but the federal judge that stopped me from dispensing in the 90s gave me the right to teach patients how to grow under a federal ruling, saying that I could reopen my dispensary not to dispense medicine, but to dispense support, cards, and the ability to let them know how to grow their own medicine in their home. All of those activities are still legal. We have 14 other states that have passed laws, and I think Colorado is showing the most infrastructure, where the state passed a regulation bill, and they raised $9 million in the first month and a half of application fees by collectives that wanted to register with the state to legally be producing and procuring medicine for patients.
What's the difference between a collective and a collaborative?
I think it's a definition of what local jurisdiction might need them to be, where you can be a cooperative, a collaborative project, or a collective. The last two don't really have legal definitions. They have more of a dictionary definition. We're a cooperative, such as we're formed at the Patient ID Center. We have to go through annual meetings. Our board is elected by membership. There's things that are out of my control because I don't own the company.
All of those organizations are considered legal within the rulings.
It depends on what jurisdiction you're at, because some want you to operate in a very specific way. In the city of Oakland, you can't make excessive profits if you're dispensing medical cannabis. In the city of LA, you have to almost be a nonprofit organization under the state law. You can't be a nonprofit corporation with tax deductibility under the federal law to do this, but you can be a nonprofit corporation to say that you're not making profit. But I kind of take spite with that slightly, because what other drug company, what other drug manufacturer has to be nonprofit to succeed in meeting care of the patients that are there? And I think that capitalism breeds potentially one of the better options, which is what's the best cost-effective measure to move forward with. Colorado allows there to be profit in the industry, and I think the cities and the counties are receiving some of the feedback from the sales tax that's collected. Here in the state of California, last year I think we collected about $150 million in sales tax out of the collectives or the cooperatives that were dispensing medical cannabis. And that goes back into the general coffers at the county level for the Board of Supervisors to make decisions with at about 1%, and the other 8% goes into the state coffers to hopefully pay down our debt.
All right. We're here with none other than Mr. Jeff Jones. He is a professor at the Oaksterdam University, which really helps to educate us about medical marijuana. And he is the executive director of the Patient ID Center right here in Oakland. Stay tuned. We've got a good one for you, and we'll be right back. Welcome back. I'm Dr. Jeffrey Watson. We're right here on the Healthbeat Show. I am learning so much from Mr. Jeff Jones. He's the executive director of the Patient ID Center and a professor at the Oaksterdam University, where he teaches people how to legally grow marijuana if you have had a recommendation by a doctor. Now, the recommendation by the doctor also allows for a caretaker to have a card or pick up, procure, grow medical marijuana as well. Is that correct?
Yes, Prop 215 that was passed in 1996 allows for a designated caregiver of the patient to help with them grow the medicine or procure it or possess it for them. It doesn't allow them to use the patient's medicine, but gives them the right to assist them. So it protected a wife or a custodian, or in the sense of a hospice, the caretakers that might be going back and forth to help them get access to it.
Now, I understand, I think of myself as a primary caretaker. I'm a physician, and I asked the question in the class, could I get a caretaker card, being a provider of patients? But I understand that the patient has to reside with the caretaker.
Under the court rulings of the Supreme Court, the caregiver policy really has to do with a close family relative, somebody that's employed by them or is related to that entity day-to-day care, that they have to do more than just provide them cannabis. You could potentially qualify into that status of ongoing care, but I think you would be more in the standpoint of getting under the exemption of SB 420, where if you're running a resident hospital or a place for like an extended care facility, that you're exempted from a lot of the status that goes forward, that you could actually have a resident hospital grow cannabis inside of it legally under SB 420, and it wouldn't be running afoul of any laws.
I understand that in the Sacramento area, a physician was recently arrested, is going to have to do time related to medical marijuana. What were the specifics of that allowed them to get in trouble?
The specifics of that case involving Molly Fry was the federal government pursuing her because of her high-profile nature. She did a lot of outspoken advocacy, so she wasn't just a regular brick-and-mortar doctor, but a cannabis specialist. And she chose to start a farm on her property with notes that were generated from patients that would come into her practice. So she was sort of testing out that primary caregiver status. Under the state law, she would have done nothing wrong. But because of her advocacy and her outspoken status and being in El Dorado County, the Eastern District federally, she was found guilty by the federal government of aiding and abetting these patients of getting access to it. And I spoke earlier that you're protected recommending it, but you're not supposed to get them access to it or direct them to where to go. The protections that you're offered for the First Amendment's about how to make them legal to use it, not how they should to get access to it.
So it's still a little bit of controversy about all these things, even for the physicians, and that's why I really wanted to learn what all the legal rules are about this, and we try to handle things in a very legal, professional way when we recommend medical marijuana. Now, another question that I had, we talked a little bit about if you're employed, and your employer, the card and SB 420, the rulings on that does not allow you to be exempt from being fired from your job if you have marijuana in your system. Now, one of my physician friends asked me, how long does marijuana stay in one system? We know that cocaine may be 72 hours. We know alcohol maybe even a little bit less than that. But how long does marijuana stay in a system that would come out in a positive urine test?
It depends on the patient's use. If they used it every day, it could be up to 45 days, at least 3 weeks. If they used it very slightly, maybe once a month, it could be a couple days to a week. And it has to do with its fat solubility and the fact that what they're testing for in urinalysis is a non-psychoactive metabolite that's stored in our body over that limited amount of time. So it's not an active thing that they're testing, an active metabolite that makes you high. It's something that's a side effect of using the substance. Some patients have reported that they've gotten their doctors to write a Marinol prescription, which is a synthetic version. It's legal under a prescribed medication, FDA approved, where they saw fit, and they've used that as an exemption for testing positive. There's only a few tests that are done by very select cities and
Does
law
that
enforcement.
usually work if they...
There's only a few tests that can tell the difference between the non-psychoactive or the synthetic version and the psychoactive form that's found in the plant. So it's a very expensive test and not very many cities do it. There are a few that do it for pre-screening. I think law enforcement normally does that kind of a screening process.
Now, patients have asked also, you know, Doc, I use some medical marijuana, I'm going for this employment, and I want to know if there's anything that I can do to clear the metabolites of marijuana from my system so that it won't show up. They ask about teas and diuretics, other masking agents. What's your thought? Are there any things that are useful in that type of situation?
That's a very good question, Dr. Watson. It's probably one of the more popular questions that we get at my office over our voicemail and off our telephone. And the first thing is that they have to abstain from use. If they don't want to test positive, they have to stop using. And the longer that they've been not using, the better off that metabolite not being found that's in their system. The less that they've used, if they just happen to take a puff off of a passing cigarette at a party or something, that's not likely to be found. If they've used it medically on a daily basis, like most patients use it, it could be 3 weeks to 45 days before they're free of it. Now, they can speed that process up. It has to do with their metabolism. It has to do with potentially how much, again, they might have been using. They can use detoxifying teas, things as simple as a diuretic, which causes water to flush through your system, helping to flush out those non-psychoactive metabolites. Some people use that window of time when you're flushing to go get your urinalysis. The problem with that is that as a doctor you'll know it's very clear urine that's coming out. Some patients choose to take a vitamin B complex supplement, which adds a very color to your urine. They can't then tell so easily. It still has all of the human hormones to show that it's a natural urine, but it doesn't have any metabolites. Because your kidneys are what's placing those metabolites as they clean out the process into your urine. They operate only at a certain speed. So as you do the diuretic, your kidneys don't speed up. The diuretic flushes more water through, that threshold lowers, so that it actually could be what's known as a false positive, meaning you don't have enough in your urine to be tested and saying it's a positive test.
Okay, we're speaking with Mr. Jeff Jones. He's talking with us about the whole aspects of medical marijuana. He works with the Patient ID Center now, and the Patient ID Center will allow one to get a card identifying them as having had a recommendation from a physician. That card should allow you to be exempt from arrest for possessing.
It helps you to get identified with law enforcement. It could be used in a tenant dispute with your landlord to say, look, I have a legal right to have this medicine or to use it in my home. In some areas where you're not able to smoke in your home, you're not able to smoke cannabis. But cannabis medically is protected if you're not putting others at risk. You can use it in your home legally or grow it. Our ID card helps to back up that you have recognition of that.
What about other forms of ingestion other than smoking? We know that it can be found in foods, foods. You can place it and cook it in foods. Does that denature it or change
Well, I
it,
think
or
that's
is it?
another good question, is that we don't really advocate patients smoke cannabis as their first choice if possible. You can use it in edible forms such as brownies and other types of food preparations. It can be cooked down into a butter property because it is fat soluble, and put on breads and other types of baked goods. We also have a mechanism that's recently been developed in the last decade that's pretty widely available, known as a vaporizer, where you boil the resin from the plant material into a vapor that you then breathe in that doesn't have smoke in it, so it takes the carcinogens out of it and the bad carbon.
How does one know how to dose? You know, well, how much is...
That's the harder part, because this is
Yeah.
a self-medicated tool. It's kind of left up to the patient to try not to dose too much. But the offset to that is that nobody's really died from over-intoxication or from an overdose with this. The side effect of using too much is that you maybe get a little sleepy, you maybe get a little giddy. If you've used way too much, say you've ate too many edibles, you might get a little bit of an upset stomach. You might become a little bit, in a sense, paralysis, or laying in your bed in a catatonic state, but you don't die. You don't have to be run to the hospital to have your stomach pumped to live through that exposure. It's probably one of the things that makes me such an advocate of medical cannabis, is the patients that use it, that get a benefit from it, aren't going to get a negative benefit from it outside of a little bit too much.
And the last important thing, before we go, it can actually cut the need for prescription narcotics.
In
Is
the,
that
in
correct?
the case of opiates, yes, where you're using very hard opiates to relieve chronic pain and tractable pain, what they found both in the science and with patients reporting to doctors is that if they use a little bit of smoked or inhaled cannabis before they use their opiate medicine, that it actually has a more potentiated effect, and they're actually able to cut down maybe by half or a quarter of what they've been using to lessen the impact on your intestines and your internal systems, which opiates are very good at relieving pain, but they're not so good on your internal body structure.
Is Oaksterdam or any other agency that you know doing clinical trials to see if this type of process would work, to see if you could use the medical marijuana, cut your opiates in half and still
Well, it
have
has
benefit?
been proved in trials already that it is a potentiated effect. The Institute of Medicine reported in their report that they released in 1999 that it did have impact. As to the details of that, it's more variable than what the cannabis that they're using is, because the opiate medicine is very controlled. It's very specific because it's made by pharmaceutical companies. We have a few pharmaceutical companies in the world making cannabis extracts. One of them is in the UK, known as GW Pharmaceuticals, and it makes an extracted medicine that's in a sublingual spray. And those are the other types of uses that we might see come down the road, where you're going to be able to prescribe that as a medicine that's very specific, controlled, and dose specific.
All right. We've been speaking with Mr. Jeff Jones. We've got to have you back because there's so much more to talk about as we talk about medical marijuana. He's the executive director of the Patient ID Center, also a professor at the Oaksterdam University. Thank you so much. How could one get in touch with the Patient ID Center and discuss some of these issues if they had further questions?
That's quite simple. We have an online website at thepatientidcenter.org. They can also give us a call at our Oakland office at 510-832-5346. And we kind of consider ourselves as a crossroads between a doctor's care and where you might need to find medicine or grow it on your own. And we try to help you avoid the pitfalls of both legal and some of the things that we've seen other patients get into when they try to use this as a remedy for their own care.
All right, I'm Dr. Jeffrey Watson. We've heard some about the alternatives in healthcare, this one being medical marijuana. Thank you so much for being with us today. Remember always that your health is your wealth, and when you have your health, you have everything. God bless. We'll see you next time.
Show me